Sattler. I am a student nurse, year 3, and I'm going to be doing a packing wound dressing demonstration today. I've already explained the procedure to my patient, letting them know about the packing, that it might hurt, explaining that they need this to just promote healing of their wound, and I've given them hydromorphone 30 minutes beforehand to my patient. Okay, so I'm going to begin by setting up my sterile field. I don't have any gloves right now, so I will just be verbalizing when I will be putting on clean gloves or taking off dirty gloves. So I'm going to start by setting up my field using aseptic technique. I'm going to be keeping that within my 1-inch border. Just going to be making sure that my sterile field has well shown edges. Alright. I don't have a blue pad for my patients. I will just be using this, and I have trash down here, so I won't be needing that. And I know that this won't be sterile, but just as a nice cloth to help keep my patient's wound dry. Okay. Alright, so that is all set up. Okay, and I'm going to start introducing things into my sterile field. Scissors for cutting the packing gauze. Some sterile gauze for packing the wound. Making sure not to touch anything there. I'm setting up my syringe for irrigation. My Kaplan tip. I will just be needing the pink portion, so putting these all away. And then I'll just be taking off this pink piece here. Just so much easier in the videos. There we go. And I'll be putting this into the sharps container. Taking one of these cotton tip applicator. The second one I'm going to be saving for measuring my wound. And some sterile gauze to help clean. And then some 4x4 gauze for a drain sponge, but I'm not full of my sterile field anyways, so I think I actually have enough 4x4 gauze in there, so I'll keep some on hand in case I need it, but I think I'll be good. Okay, so now that I have set up my sterile field and added some sterile water, I'm going to reassess to make sure everything is ready to go. If that water fell onto my sterile field, it would no longer be sterile, so I would get a new tray and get that set up, but we are keeping clean. So now that my sterile field is set up, I am going to put on some clean gloves. I'm going to move over here while keeping myself facing my sterile field, and I'm going to start taking off the packing. So I have an abdominal pad, which I'm going to use a smaller one for later because this is a bit big, and I have 2 4x4 gauze pads, and sorry, I'm going to set up for there so that I can use this to take these off. I would say they're about 75% saturated with serosanguinous tissue, or serosanguinous fluid, and now I see my wound, which has been packed. And we'll pull that out, and I'm gonna guess that's about 50% serosanguinous fluid. So I'm going to be putting all of these in the garbage. They are now contaminated, keeping my body facing, and I'm going to quick measure. When I measure, I'll be using my Q-tip for the depth. And to check to see if there's any tunneling. So looking around, it looks like the peri-wound skin is healing nicely. It looks a healthy pink. I don't smell any bad odors. Checking with a sterile Q-tip, I don't see any signs of tunneling. And I'm gonna take in the deepest portion, measure that. It's about 2 centimeters deep. About 13 centimeters long and about 2 centimeters wide. So I'm just gonna keep that in my head for later when I will be documenting. So looks like there's some healthy granulating tissue in there. There was serosanguinous fluid, like I said earlier, and I don't see any drainage, so that looks pretty much like what I was expecting. Now I'm going to be cleaning the wound. I'm going to fill this up with some, and that's a little closer than I'd like, so I'm just gonna take the Cathlon and put it on. Be sure that the area around the Cathlon is still sterile. Okay, and I'm going to irrigate the wound. I'm not actually going to be spraying too much water on there because this is dough. It is not very good for water, so with water. So I'll just be spraying a little bit. I would be going clean to dirty and getting all the sides, and I'm going to be coming around with the peri-wounds after. So that is now cleaned. That's off, and now I'm going to be taking a gauze pad here, and I'm just going to dry that. Alright, being careful to not let the forceps touch the skin, and I'm not going to go back on there, sorry. I went one swipe down, and I'm throwing that in the trash. So there is no more fluid is pouring out, so that looks clean to me. The water ran through clear, so that's good. I'm going to be taking some 2x2s now to clean the peri-wound skin. Running clean to dirty again. And clean to dirty. Okay, and now I'm going to be drying that off. Now the inside's dry, so it's just the outer sides now. Clean to dirty. That looks dry, and clean to dirty. Wonderful. Okay. Now that my wound is clean, I'm going to put these off to the side, and I'm going to don my sterile gloves. Pardon, this would all be in the garbage, but I don't want to drop them on the floor. With So my gloves, I'm not wearing any gloves now. Now I'm going to be putting on sterile gloves. Noises in the hospital are okay. Okay. I'm gonna put on my sterile gloves quick. Okay, and now my hands are sterile. I'm just gonna pack up my wound. So, I'm gonna pull a little extra just to make sure I have enough. And normally I would just soak the entire Curlix in normal saline, scrunch it up in my hand, but because this is a demo, I need to reuse it, so soak it up so it is all wet with the normal saline. Okay, now I'm going to take a Q-tip. Gloves are a bit big, but that's okay. And I'm going to pack my wound. And it's okay to get a little bit of the peri-wound skin as long as, because I've cleaned it. So I'm going to be making sure that the packing is gently in there. It's not going to be pushing too far, but just enough to keep it all soaked with the normal saline. Double checking again. If I really wanted to, I could use the sterile forceps or my gloves, but I feel like the Q-tip is working just fine on my wound. Alright, and I do have a little bit of excess here, so I'm going to... I did touch the wound, but that is part of the area cleaned. So it's still sterile. I did just glance the edge of the table with my hand, but that part doesn't need to be sterile, so it's okay. Okay, gonna drop those out of my field. Make sure that this is packed nicely, not touching any of the peri-wound. Okay, and that looks good. None of it should be touching the peri-wound. So, okay. And there we are. Okay, so now I'm going to be using my two 4x4s on here, and my hands don't need to be sterile anymore. What the inside of this slightly smaller abdominal pad does. No need to worry about my sterile field anymore, which I'm going to put like that. Use some tape over my wound, and I will document and make sure to monitor it to make sure that it is still healing properly and getting the dressing changes it needs. Thank you.